scenario, Waris Theory is currently admitted to the acute stroke unit and is under therapy due to her stroke. She has swallowing problems and needs a short-term enteral feeding to prevent further weight loss and prevent aspiration. Her doctor requested for her to have a fine-bore nasogastric tube to be in place for about 2 weeks to ensure adequate nutrition and hydration. Please insert the fine-bore nasogastric tube and provide appropriate health education. It is today and it is 0800. So for starting my station, I will just be doing my hand hygiene according to 7 steps of WHO. 1, 2, 3, 4, 5, 6, 7. Let my hands dry, and now I'm going to my patient. Hello, good morning, Waris. That's what I told you a while ago. My name is Ruel, and I'm gonna be your nurse today. So I'm here to do a nasogastric tube insertion, as what the doctor has explained to you. We're going to put the tube from your nose directly to your stomach. This is to prevent further weight loss and also for your nutrition. Do you still want me to proceed?
Yes.
All right then. So before starting, just want to tell you that later if you will have any difficulty breathing while I'm inserting the tube, just raise your right hand so I can stop the procedure. Will that be all right?
All right.
Okay then. So let me just assemble the equipment that I need, and we'll do the procedure. Okay.
All right.
All right then. Okay, so I have here my equipment. I have here a tray which has been cleaned with soap and water for the past 24 hours and already been inspected with clean wipes. I have here a page indicator strip which is dry, intact, in date, and the color is not faded as well. And I have here a warm glass of water, and I have here a dry, intact, in date NG tube, and it's also radio opaque. And I have here a hypoallergenic tape which is dry, intact, and in date. And I also have a enteral syringe which is dry, intact, and in date. And I will also have my kidney basin. So for starting, I'll just have to wear my apron, which is visibly clean. I'll be wearing my gloves from pack, which is dry, intact, and in date. Now I'm ready to go back to my patient. Hello, Waris. Now that I already have the materials that I need, I just want to let you know that this procedure may require you to sit upright. Okay? So
Okay.
now you're ready sitting upright. What we're going to do now first is to measure. I'm going to measure from your nose to your earlobe. So I'll be measuring the tube from your nose to your earlobe, and from your earlobe to your sternum. Okay, so I got it here, around 40. So just want to make sure your nose are patent. Is it alright if you take a sniff from your right nose and then you cover your left nose?
All right.
Okay.
Done.
Can you do that again on the other side?
Okay, done.
Alright, great. So both nose are patent. So is it alright if I'll use your left nose?
Yeah, that's fine.
Okay then. So I will now be inserting the nasogastric tube. First thing first, I'll just have to lubricate 15 to 20 centimeters the end of the tube into the warm water. And then just have this basin. Alright, so I will now insert the tube, Waris, okay?
Alright.
So I will be inserting the tube inwards and backwards along the nose, floor of the nose, down to the nasopharynx. Okay, if you feel any respiratory distress, or if you will feel short of breath, just let me know, Waris, okay?
All right.
Alright then, that's correct. Okay, so I'm just inserting. If there will be any obstruction felt, I have to remove the nasogastric tube and try again a different nostril, try a different position. So I'm just inserting it now. So making sure that I reach the desired measurement. Alright, so are you still alright, Waris? Do you feel any short of breath? No, you're right. Okay, correct. So I got it now, and then I'm just gonna put a hypoallergenic tape to put the tube in place. Alright, and I'm gonna aspirate for fluid. I have to dispose of clinical waste bin. I'm gonna aspirate for fluid using this syringe. Alright, I have to aspirate. Okay, I was able to aspirate 5 mils. I can aspirate 1 to 2 mils. I'll just cover it up. Alright, I'm just gonna transfer to my. Just gonna transfer here. So just transfer the water. And I'm gonna check for pH. So the pH should be less than 5.5, and I can see it's 5.5, so I'm happy. I'm happy with that. It's on the right, it's in the right placement. So it also puts clinical waste bin. Alright, so Virus, we're done with the procedure. Thank you so much for your cooperation. I'll just have to dispose this clinical waste bin. So, are you comfortable at the moment?
Mm-hmm.
Alright, great. So I have here a call bell. If you need any help, just press the orange button. We'll be there to help you, okay?
Mm-hmm.
And just let me know if you will feel any discomfort with the NG tube, okay?
Mm-hmm.
Alright then. So I'm just going to dispose this clinical waste bin. I'm just going to document what I've done. So my signature, date, time, length of tube, which is 40 centimeters. NG aspirate pH is 5.5. Alright, so now I'm done with the procedure. I have to make sure that the tray will be stored, cleaned, and ready for next use. And I will also have to dispose this as well to the clinical waste bin. And then I also have to store the strip according to hospital policy. So, and that's it. And I'm just gonna end my station with 7 steps of hand hygiene. And while doing that, we also have to make sure that prior commencing feeding, we have to make sure we do additional checks like X-ray, as well as the pH. Alright, so